Hi, I'm Benita. I specialise in endocrinology and my practice is in far north Queensland. This time last year, my clinic was flooded after a big storm and I had to close the clinic for a few weeks. I realised that it would be very useful to my patients if they could access their key health information in a crisis through my health record. I was a bit hesitant at first as I thought it'd be time-consuming. However, there are many benefits, like creating efficiency in my practice by avoiding duplication and improving patient outcomes. Come, join me as I complete the prerequisites needed to register for my health record. First, I'll need to determine how I wish to participate. Most private practice specialists are likely to register as a seed organisation. A seed organisation is a legal entity that provides or controls the delivery of healthcare service, or as a network organisation. These are different departments or divisions within a larger complex organisation, such as a hospital or multidisciplinary healthcare practice. I will need to register as a seed organisation. I will register as a seed organisation in the Healthcare Identifiers HI service. I'll need a Healthcare Provider Identifier Organisation, HPIO. There are 4 key steps that I need to take to register as a seed organisation in the HI service. Step 1. Log on to PRODA. Select Go to Service on the HPOS tile. Step 2. Select My Programs, then Healthcare Identifiers and My Health Record. Step 3. Select Healthcare Identifiers, register seed organisations. Step 4. Follow the steps outlined to register as a seed organisation. Now, I'll have to assign roles and responsibilities. The first role is the Responsible Officer, or RO. The RO is registered with the Healthcare Identifier Service and has authority to act on behalf of the organisation. This is usually the business owner of a private practice like me. If I worked in a hospital, the RO may be the CEO. The second assigned role is the Organisation Maintenance Officer, the OMO, who acts on behalf of the organisation and completes day-to-day administration. This role can be assigned to a practice manager or other senior staff who are familiar with the practice's clinical and administrative systems. Sean is the practice manager of my clinic and will be assigned the role of the OMO. Sometimes the RO can take on the OMO role too. I now need to decide on the type of access I require. The first option is using conformance software. This means the clinical information system I use in my practice is conformant to connect with my health record. This allows me to view, download and upload my patients' information to their My Health record. To check if your clinical software is conformant, visit the Australian Digital Health Agency's website. The second option is the National Provider Portal. I'd choose this option if I didn't have conformance software, but it's read-only access to a patient's My Health record. If I use this option, I won't be able to upload documents to my patient's My Health record. I'll now need to prepare to implement the new system within the operations of my practice. This means ensuring I meet the legislative requirements to participate. To be compliant, I'll need to implement a My Health record system security policy. And for organisations accessing via conformance software, you'll also need the National Authentication Service for Health, NASH, Public Key Infrastructure Certificates policy. There are policy templates available that you can adapt for your private practice or organisation. The Australian Digital Health Agency has a privacy and security compliance checklist available, covering several sound privacy and security practices, such as security and access policy, managing user accounts, identification of staff, staff training, handling of privacy breaches and complaints, risk assessments. The RACP's My Health Record Best Practice Guide gave me guidance on the privacy and security requirements. I used the security and access policy template found in the guide and customised it for my practice. I'll now need to ensure my staff are also trained to use the system. There are several training resources available. The RACP's My Health Record Best Practice Guide outlines the training options I can access for my staff. You can download a copy of the guide from the RACP's website. Go to Fellows, Resources, and then select Digital Health. It was great to have you with me as I completed the prerequisites needed to register. Remember to join me next time when I go through the steps to register and connect to my health record. If you need any help, contact the Australian Digital Health Agency's registration and support team or visit their website.